we'd like to welcome Dr. Ryan Vaughn from Exhale Sinus to the Morning Blend. Good morning, Dr. Vaughn.
Good morning. Thank you for having me.
Yeah, thanks for braving the cold. We appreciate it.
Well, let's talk about, first of all, you're fairly new to the Rockford. How long have you had the old shingle out there on North Perryville?
We stuck our shingle in the ground in July of last year, so just over 6 months.
Oh, that's fantastic. What's it been like since you guys have been open, seeing more people come in? What's the journey been like?
The journey's, I love bringing something new to a community. Watching those first patients walk in is something that is just so satisfying. Part of our vision at Exhale Sinus is to really change the way that patients receive healthcare. One of the things that I take a lot of pride in is that we really slow the schedule down, allowing us all to take extra time with our patients. When somebody has sinus issues, headache issues, migraine issues, TMJ issues, these are often things that patients have struggled with for years or decades, and your standard office visit of 10 minutes long, you just can't get the whole story out.
No, you definitely can't.
Cannot, right?
Yeah.
So when somebody comes to Exhale Sinus and we're spending 45 minutes with that person, it can be, not trying to be dramatic, but it can be life-changing because we can actually put that story together, and then as they leave the office, they actually have a plan of how to change their life for the better. It's something that obviously is life-changing for patients, and I walk out of the office at the end of the day feeling like not only am I contributing to this patient, but also to the community, providing something like we were just talking off air a moment ago about how there are not many ENT physicians that are in the Rockford area.
Ear, nose, throat.
Ear, nose, and throat.
It's a huge need, and you guys are able to address that.
Right, right. Yeah, so that's the other side that's so incredibly satisfying, knowing that we came to an area that we would define as medically underserved, and then bringing this higher level of care to patients that really have these problems that have been present for years and no one's really adequately addressing.
Yeah, sinuses can be kind of the most annoying thing to have to deal with for a lot of people because it's just constant. You never know if it's a cold or if it's an infection, allergies, any of that. What's kind of the differences between them?
Yeah, sure. So, you know, we break this apart in different diagnostic categories on how things are on a daily basis versus like an acute flare. So it is not uncommon that I see somebody walk through the doors and they will say something like, well, I don't really think I have sinus problems, I just have headaches. Okay, fine. We get a scan and the conversation will then gear towards, oh my gosh, sir or ma'am, you have really significant sinus disease. You have just accepted that every day is supposed to be
like
slightly miserable. When it doesn't. It doesn't.
You would be shocked. I'm sure you see people all the time that's just, they're like, oh, I just live this way. I just live this way.
I'm just supposed to be swallowing my postnasal drainage, not breathing well through my nose, snoring. So that would be the chronic condition, right? So then we have the difference of those, what we call acute flares, where it goes from basically not great to really bad, or bad to worse. And that will typically start where all of a sudden it's, maybe starts with that throat tickle or some sneezing, and then over a few days starts to get worse.
Yeah.
And so sometimes that can last for 5 days, gets better on its own. In those patients with chronic sinusitis, it will typically persist and linger. That's that cold that then turns into an infection. 3 weeks later, you're still coughing and blowing your nose.
Oh, yeah.
You might need a course of antibiotics. And so that's what we're really working to try to figure out. How do we bring down that baseline inflammation and then try to prevent those acute flares? And now in contrast, the allergy question, right?
Because a lot of people are like, I'm not sick, I just have allergies.
This is like, I always get this time of year.
Yeah,
so
they're
I
like,
must have an allergy to whatever, So.
That's exactly right, right, absolutely good point. And so allergies can be seasonal, where, just when this one tree blooms, I have an allergy to that tree, and I'm only going to be symptomatic, which is typically that stuffy nose, sneezing, itchy eyes. But you could be allergic to really anything. So if you have a dust allergy or a mold allergy, that's going to be something that's year-round. And so there are scopes that we can do in the office, but really it's testing that we do in the office to figure out what are your symptoms coming from. Is it an allergy where it's your immune system inappropriately treating a pollen molecule as if it's a virus, right? So it's this kind of inappropriate immune response. Now we can do blood testing or skin scratch testing, and we can find out really quickly if it's an allergy or chronic sinusitis or possibly both.
Oh, that's really interesting how you guys are able to do that. I've always wondered kind of how you diagnose and figure out, but I mean, that's what the doctors are for.
What's the thing you see the most here in the cold, dry season at Exhale Sinus? I know this is your first cold, dry season, but you've been practicing this for a while here. But what's the first? What are you seeing a lot of this time of year?
Yeah. This time of year is, as soon as we head back to school, within a couple of weeks, we start seeing all of the colds and flus, and now COVID, and now norovirus, and all of that stuff is going to be hitting our nose and sinuses, causing those acute flares where somebody was kind of just like hobbled along throughout the rest of the year, and we see people coming in, I just cannot get over this sinus infection or this cold. The other things that we see more commonly, especially on a super cold day like today, is going to be those super dry air hitting our nose, nosebleeds, dry nosebleeds. And then for those TMJ and migraine sufferers, they go outside without a hat on and their ears and headache just blow up.
Really?
And so that cold wind that you talked about just a minute ago, that cold wind hits somebody who's suffering from TMJ issues, and they are miserable, absolutely miserable.
Wow.
TMJ is?
So TMJ is temporomandibular joint, so that's going to be up here. And so typically TMJ issues are going to be less joint, more muscle. So actually within the field, we talk about TMD, temporomandibular joint dysfunction, because most of it, the joint's fine. It's really the muscles that get tense and tight. And then if you can imagine, just similar to if you are working your bicep a lot, that muscle's tense, these muscles get tense. And any irritation like cold air, wind, stress that causes you to clench your teeth is just going to make that stuff worse.
Oh, wow. That's really interesting, because usually when people think of that, they just think of the jaw. They don't think of the things associated with it.
Yeah, right. And so the symptoms that we see from TMD, that we could kind of pivot to that phrase, can be anything in this area that includes ear ringing, ear pain, dizziness, headaches, migraines.
I got to get a checklist here.
I know, we're both like, when do I make my appointment?
Now, and here's the $1 million question. As a fairly new practice here, how aligned are you with insurance? So because I think a lot of people aren't going to go to you unless
it's
not a lot of it's covered.
Yeah,
here.
it's not their first thought, because that's usually what they think.
So we try to be in network with as many insurances as we can. So whether that's Blue Cross or Cigna or Aetna, we're taking all Medicare and Medicare replacement plans. We do our best to be in as many networks as possible. And for some of those smaller networks, we have actually joined a number over the last 6 months, whether it's the unions that have smaller networks. So if you have a question, give us a call. The other thing that we do, if we happen to be out of network, or if you don't have health insurance, or if you have like the catastrophic health insurance, we have cash pay prices that are discounted.
Okay.
Really just trying to make care with us accessible.
Oh, that's fantastic. That's a huge
By the way,
piece.
tomorrow's the last day to sign up for Get Covered Illinois. Go to Get Covered
There you
Illinois.
go. Don't
plug.
forget.
Good.
So I'm just throwing that out there.
You get covered, and then you can go see the ENT and get everything figured
Go see
out.
Dr. Vaughn at Exhale Sinus. You're on Perryville Road.
We are in the old Crimson Ridge building.
Old Crimson, okay, right there. All right, there, just north of East State Street, probably within pecking distance of the I-9 or Perryville camp. East State.
Right down the road.
Yeah,
So if you know where that is, just keep going.
And you have exhalesinus.com as your website.
Exhalesinus.com is the website. We've got signs out on the road so you can see us pretty easily. And we do a social media push to try to provide education. We're trying to put probably about 3 videos out a week just on a kind of a rolling basis to address things like cold, other things like runny noses that are more common in the cold air.
I got like 6 other questions I want to ask, but I think we're running out of time.
I
saw on the top of that
we
website
are.
sleep apnea.
Yeah.
I got that, and I have a mask. Now I've seen commercials for other types of non-mask treatments.
Right.
Do they work? And
Is that something you kind of deal
work with?
Some of them work.
Yeah.
yeah, absolutely. Some of them work and work amazing. And so like I sleep with a mouth appliance. So then I don't have to do a CPAP type of a mask or a hose, right? but I also needed nasal surgery in order to be able to breathe through my nose so that I could wear plastic in my mouth. Now, the number one thing that we see somebody struggle with CPAP is that, besides they don't want the hose and the machine and whatever, they can't breathe well through their nose, right? So if we can't get air through our nose, then we have to rely on our mouth, and then that pushes your tongue backwards, and it just makes the whole experience miserable, right? So we talk about CPAP a lot, that's a fallback if we absolutely have to, but the therapy of improving somebody's upper airway through medications, treatments, therapy, surgery if we need to, and then if we need to kind of drop down to the next level, using what's called a mandibular or jawbone repositioning device, that actually can stabilize your jaw, and that's what I sleep with, right?
Okay.
So that not only helps with sleep apnea, snoring, headaches, and TMJ, really? It's really this catch-all that we can program it in a way that is very effective.
Yeah.
We just have to have kind of the anatomy that supports that.
So dealing with snoring can help deal with a lot of other things. Yeah.
Right.
It's kind of
and
the first
snoring.
piece.
Yeah. So snoring is not only disruptive to your bed partner, and we've seen in some small studies that the bed partner of someone who snores is at a higher risk for stroke.
Wow.
Crazy.
I was like, that is cool.
On that happy
Make sure we're
note.
not snoring.
Well,
So it's not only all about us,
Yeah.
it's about our bed partner too.
okay.
Yeah.
All right. So if you have a million more questions like we do,
I know, we could go on forever.
Exhale Sinus is on North Perryville Road, the old Crimson Ridge building there. At 977-5715 is the number. ExhaleSinus.com will probably answer most all of your questions there. But give Dr. Vaughn a call or email or however, and get in touch with Exhale Sinus, and fairly new to Rockford now, celebrating its first half year. Thank you, Dr. Vaughn.
Thank you.